As a smart city, the socio-economic potentials and prospects of Lagos makes the city a global brand of choice and, of course, an undisputable investment haven. Lagos is the future. Let's talk about our Lagos once again on the City of Lagos TV show. We'll be right back. You're still watching the City of Lagos TV show. Let's put you on speed on latest engagements of the number one citizen of Lagos, Mr. Babajide Sanwo-Olu. Welcome to From the Governor's Office. First, the Lagos State Governor, Mr. Babajide Sanwo-Olu, alongside key cabinet members, top Muslim clerics, political associates, were all in attendance at the prayer session held in Lagos as part of the activities to celebrate the 70th birthday of Asiwaju Bola Tinubu. Mr. Governor, who revealed what inspired the prayer session, noted that prayers for the elder statesman is the best gift to appreciate the great works of Bola Tinubu.
Asiwaju, some of us are lucky. 24 hours ago, all of them were still praying for you and they were still praying for our state. And today again, they've come out in large number to come and celebrate and to thank God for your life. The first thing we should do before you people come and take him away politically, we should offer prayers in the morning for him, because that is the greatest gift we can give to him. Prayer is the key, and prayer is the tonic that he requires and he needs, most especially.
Governor Babajide Sanwo-Olu was quite impressed with the photo and video exhibition put together recently in Lagos by Mr. Dayo Adedayo to tell the story about the life and times of Asiwaju Bola Tinubu as part of activities to celebrate his 70th birthday. Mr. Governor described the exhibition as unique, informative, and authoritative about the man, Tinubu.
A photo exhibition is next to none that I've seen. And it's important for us to put it in context that we're celebrating a man when he's still alive. When you can indeed step back, soak it all in, and you can see how people appreciate you. This celebration is not just about Mr. Dayo. It's a combination of other outstanding photographers of like minds as himself, and able to pull all of their archives, pull things that are, some are 30, 40 years, 50 years, in history, and put together a story about a man, his journey, family, friends, political journey, taking Lagos to the level that it is today, and the Nigerian conversation all around. And that's what we've seen here. So I'm truly, really excited that I've been able to do this in pictorial form. Right? And I'm actually very impressed with the audio studio. That, I think, is very first. When you have all screens and you can, wear your earpiece and listen to great speeches, that have been said by this great Nigerian.
The 13th Bola Tinubu Colloquium was supposed to be a memorable event for Governor Babajide Sanwo-Olu and eminent guests from diverse areas of endeavor in attendance. But it turned out to be a day and moment for sober reflection for the celebrant to honor the dead as a result of the news a night before about terrorist attack of a train between Kaduna and Abuja, leaving over 60 people dead.
Today is supposed to be a very joyful 70th birthday of mine. I've this morning given thanks to God Almighty for being able to survive to this age. And I've just been informed of a very sad incident in our country, that over 60 people and many more were killed and bombed on the train between Kaduna and Abuja. That is a very serious incident, and it calls for a very serious, sober reflection. To me, to be here celebrating, dancing, and enjoying myself doesn't show enough concern of a statesman as a senior citizen of this country. I will urge the two clergies who are here present, continue to pray, and every one of you to go home and pray.
And that's it from the governor's office. Next week, we'll bring you fresh updates from the office of the number one citizen. The City of Lagos TV show will continue right after this timeout. You're still watching the City of Lagos TV show. We welcome you to Health Lagos. And today we're going to be looking at a very strategic and critical agency, the Lagos State Health Management Agency, LASHMA. And this is one agency saddled with the responsibility to ensure quality health care for Lagosians. And so we're going to be speaking with the General Manager of LASHMA, Dr. Emanuela Zamba. It's a pleasure to have you on Health Lagos.
Thank you very much.
What is the mandate, vision, and mission statement of this agency?
We are actually saddled with the responsibility of ensuring that all Lagos residents, regardless of their socioeconomic status or even ethnicity, have access to quality and affordable healthcare in Lagos State. So our vision is to impact the health indices for residents of Lagos State, improve their welfare and their quality of life by universal health coverage, which is to be achieved through ensuring that everyone has access to health insurance.
In line with the themes agenda of Mr. Governor Babajide Sanwo-Olu, can you let us know what are the major critical efforts, initiatives, programs, projects, and achievements of the agency in relation to the agency's mandate?
This agency is one of the newest, actually, amongst the agencies in Lagos State. We were launched in 2018, and we actually started working after a lot of planning in 2020. So our achievements have been over the last, say, 1.5 to 2 years. We're very grateful to our governor, Mr. Babajide Sanwo-Olu, because he has been fully behind this agency. As I'm sure you know, one of his promises to the people was that he would make sure that there is access to health insurance. So first of all, we felt that it was necessary to rebrand the Lagos State Health Insurance Program to make it more recognizable and something that the community would want to own. Let's face it, insurance is something relatively new and a bit scary to people generally because we're a very spiritual and cultural people. So when you tell someone to come and pay for a sickness that hasn't come, it's like, please, God forbid, it's not my portion and things like that. So we felt, look, let's look at it from more of a wellness point of view and how it is your priority to save for a rainy day. So we rebranded the scheme and we called it Ilera Eco, which is to say the health of Lagos. And that is what we have been propagating since then. After we did the rebranding, we felt it was necessary to have something that when people hear it, they recognize it as like a call to action. So we came up with a theme song competition and we eventually got a winner who we now have this song that is on the radios and everywhere that people know. At least you recognize it when you hear it. Okay, this is about Ilera. Well, what is this? Trying to keep it in the consciousness of people that this is something that you should take as a way of life. Just as you pay for your insurance in your cars, you should be able to pay for insurance for your health, and take it as something that is a norm. Moving forward, we also have been able to, using actuarial analysis, design a bouquet of plans for people. So we were inundated with requests. You have subsets of the population that have various needs, and someone that's over 60, what he would be looking for in a plan is very different from a lady that is still in her reproductive age and people that are growing in a family. So we have a standard plan, which is the one that we are marketing majorly. We have now come up with a standard plus, which is for people with a little bit higher earning power and has a more robust package. And then we have what we call the seniors plan. So from request for some NGOs and elderlies in the community, we designed a plan which allows them to have screening on a yearly basis for cancers and things like that. And so they are sure that they are, walking in health. We also have what we call the school plans. So there's one for primary and secondary, and then there's another one for tertiary institutions. Recently, we came up with EcoTelemed. It was a child born out of circumstance, and that platform helps people in the community to be able to reach out remotely to a doctor. So you don't have to visit the facility every time. If you buy into that plan, you are able to get free consultation. The doctor will give you a prescription and referral and so on. And it is also a fundamental part of the state's COVID response system. We've also been able to initiate what we call our grassroots channel. We've been able to open 5 divisional offices in the 5 divisions of Lagos State. So we have offices in Ikorodu, Badagry, Ikeja, Lagos, and Ekpe. We also have 30 sales kiosks spread across the local governments and LCDAs. We can't be everywhere, so that is being managed or operated by private partners in the health insurance space. We call them our marketing agents. Also, we realized engaging the informal sector that while we say our prices are affordable, so the standard plan is 8,500 for an individual per year and 40,000 for a family of 6. Once you pay your 8,500, you are entitled to get access to that care. If you're a family, husband, wife, and 4 children, now it's under 23. We've increased that. It used to be under 18. You also have access and you pay your 40,000 for the year. Now, the benefit package that you enjoy under this scheme, the common ailments you would walk into a facility for, this plan covers about 80% of that. So you have a febrile illness, upper respiratory tract infection, hypertension, diabetes, asthma. Your wife is pregnant, she has her antenatal, she delivers under this scheme. And cesarean section is also free. So if she requires a cesarean, once you've paid your premium, you have access to cesarean section. If she needs a blood transfusion, she gets it as well. Appendicectomy, for instance, herniorrhaphy, you have access to 4 different types of consultants throughout the year. You're able to get glasses. Of course, the price is pegged. You are able to see a dentist. We do extractions, we do scaling and polishing, and of course, diagnosis. So you need an ultrasound scan, you need an x-ray, some lab tests done. All these things and a little bit more are covered by the scheme. Of course, you have access to drugs. 80% of what you would walk into a facility for on a normal basis is what this scheme actually covers. And so for this 8,500, you are really rest assured that unless something extraordinary happens, your family and yourself are covered. When we first started, we had maybe about 9,000 people. Right now, we've grown that number to about 563,000 and counting. You have to register. You can do that either online, so you go to our website, or you call our call centers. You can also walk into any of these offices that I said we've set up in the division and also in the sales kiosk. Some of the hospitals also act as enrollment agents. So if you walk in, there's someone that has been trained in that facility that will walk you through what you need. So you have to pay before the 25th because we need to have managed all those numbers and sent to the hospitals for them to know who is active for that month. We will not be able to activate you. As you're registering, you get an SMS on your phone that lets you know what your policy ID number is. And you are the one that chooses your facility yourself. So you already know which facility you're going to. You have the liberty of asking for an ID card. You will be given an ID card. So when you walk into the facility, all you need to do is go to their front desk, show them either your ID card or read out your policy ID from your telephone, and they will check on the system. And once your name is there, they've seen that you're activated, they attend to you, just to make sure that it's efficient and customer friendly.
The city of Lagos is a cosmopolitan city with a huge population. And of course, data is quite important for an agency of this nature. So can you give us a clear picture on the data gathering strategy or success of this agency?
We're IT based. From end to end of the value chain of what we do, it is. So registration is also IT based. When you go into the facility, the encounter that you have is also IT based. So the doctor enters everything onto the system. So we get that data in real time. What did you come to the facility for? We're able to tell you at the end of every month, so number of people came in, this is what they came for, these were the medication that was used, etc. How many people have been registered? We can give you that information in real time to help us to plan. We are responsible for recruiting people who have the requisite skill to come and add value here, while we also have a determined program to build capacity in-house in terms of government employees that will propagate this mandate of health insurance. And we do have various technical departments, budget for human capacity development in terms of honing people's skills. We recently went on a study tour to Rwanda to see how things are being done there. We have sales clinics that are conducted on a weekly basis for those that are on the field enrolling people. So we are introducing them to newer ways of doing things. And if there's something that we have introduced newly in the agency, we pass that information. And even our operations team, we have some partners that are supporting us in helping us to build capacity as we go along.
For the records, how many registered health facilities are in Lagos? And what is their present condition and how effectively functional are they?
We only deal with those that have been empaneled for health insurance. Right now, we have about 250 facilities participating with us, and that spans across public facilities, primary healthcare, some primary healthcare, secondary healthcare facilities, as well as private hospitals. In fact, we have more of a preponderance of private facilities currently that are working with us, and it's spread across all the local governments in Lagos State.
What are the challenges? Let's share those challenges and how have you been able to surmount them?
I think the major challenge would be the fact that people don't understand the benefits that health insurance brings to their family, and how just putting away a little bit of money in a determined manner can actually improve the quality of life of your family. So that is, I think, the biggest challenge. Awareness is extremely important. So that is something that is being done on the daily. We have programs on radio stations that run every week, and people do call in. They ask questions, so we are available to make sure that happens. We are very visible and vibrant on social media. We also have divisional offices, so they do go out on a daily basis to engage subsets of the population. We conduct community storms, market storms. Just had like a grassroots sensitization program that we are winding down, where we went to all the local governments. We've added a little bit of incentivization just to ensure that people get some kind of willingness to come forward and pay. We have like a raffle draw. So right there and then people win prizes, and you see that people come out and buy the health insurance. So it's a continuum.
What is the level of synergy between your agency and other agencies?
Our governor is someone that preaches intersectoral collaboration. We are in partnership with a lot of agencies, not just in health sector. For instance, the grassroots sensitization I spoke about now was done in collaboration with the Office of Civic Engagement. And we're also working with Ministry of Agriculture, Ministry of Education, who has given us access to the schools, Ministry of Local Government and Chieftaincy Affairs, Lazarus, who has the ID card. We will make sure that you can use that card also to access care. That is something that we're working on. Lagos State Employment Trust Fund, we're working with the CSOs, for instance, who help us look at quality in the facilities. And we also have a lot of people that have come our way to help us in paying for the vulnerable. So that we have private sector companies. We do have some of our political leaders that have come forward to provide the premiums for those that are indigent in their society. And internationally, we have people like Bill and Melinda Gates working with us. USAID, for instance, are also here. So the entire gamut of people, especially those in the social welfare space, and those that are like gatekeepers for members of the community.
2021 is gone. What is the roadmap for 2022?
As part of our plans for 2022, we intend to commence deployment of what we call virtual clinics. So there are some areas where we are able to identify need, but there aren't facilities to give people access to care. So these virtual clinics act as a stopgap for people to be able to walk in and virtually consult with a doctor that will help them in accessing healthcare. We are also looking to establish what we call Ilera Eco-Care clinics, which will be set up in areas and will be partnered by private facilities. So some of these big brands who people have identified with quality would come in and help us manage access to care for the general masses, right? But bringing their quality into that space. We are also looking at deepening our engagement with the schools, because we need to inculcate this culture of health insurance from these children. So by the time they reach the age of their parents, they already know that this thing is a norm and they all need to key into it.
On a final note, Ma, as a passing show, what is your word of encouragement and assurance to Lagosians, your stakeholders, in order for you to maintain the success story?
People of Lagos, Ilera Eco is here for all our benefits. I don't think you can get it any better in terms of the scope of services that are being offered and the cost that is attached to it. It is the cheapest way and most affordable way for you to assure quality of life of you and your family, so that you have money set aside to do other things for you and your family. So we implore you to please key in to what Ilera Eco has to offer you. Let's walk this walk of health and life and wealth for Lagos State.
Thank you very much, Dr. Emanuela Zamba, for coming on Health Lagos.
Thank you for having me.
Well, that's it for now. The City of Lagos TV show will continue in a moment.
There are so many factors that are responsible for deaths in businesses. Number one, competition is big. Number two, power is not available because a lot of businesses, if you are establishing in Lagos, you have to provide for yourself the power. The same thing you are paying tax for, you have to go and provide them for yourself. And then another thing is informal harassment. So if you're building a business in Lagos, you need to be tough.
Power is one of it. Also access to funding because somehow things are a bit expensive.
Number one, when you look at the environment in terms of time, so many things consume the time of people in Lagos, most especially the traffic condition. You cannot be productive while you are stuck in traffic for 2 to 3 hours every day of your life.
Traffic and security are one of the major issues we have in the only business in Lagos. You pay a lot of tax. Then I believe that getting people to work in Lagos is really hard.
Lagosians, let's rock and roll on Entertainment Lagos on the City of Lagos TV show. But first, let's keep you posted with latest entertainment gist right away. My name is Joy Olaide. First on entertainment gists, British-Nigerian actor Hakeem K. Kazeem is set to commence production for his directorial debut for his film, It's the Blackness. The movie stars Colloquium and Mercy Dolapo as lead actors. Nigerian superstar Tiwa Savage has announced a 17-stop water and Gary tour of North America, US, and Canada. The tour is set to commence from May 15th to June 19th, 2022. Nigerian star and Empire frontliner Joe Boy has announced his maiden tour of the US. The tour is slated to commence from the 1st of May to the 20th of May 2022. The show is promoted and organized by Duke Concepts. Finally, on entertainment gist, American actor Will Smith has bagged an award as the best actor at this year's Oscars for his exceptional character Richard Williams in the biopic King Richard. In the same vein, following his outburst and infamous punch of the comedian Chris Rock at the just concluded Oscars award, Will Smith has tendered an unreserved apology to Chris Rock. And that draws the curtain on our entertainment gists. Let's now bring in our gospel artist of the week, OMODIA. Get ready to be blessed.
Hello Lagosians, my name is OMODIA, of course, your gospel artist of the week on Entertainment Lagos on the City of Lagos TV show. It's hallelujah time with me. I will be right back. Okay, Lagosians, we're back. Okay, I know say, I don't know who I be. Well, my name is OMODIA Okwelegbe. I'm from the Asian-speaking part of Edo State. I've been in the music industry for like 11 years now, professionally. I found Jesus and I found gospel music because I like music. The gospel is for reconciliation. Gospel music, taking people back to their creator. My mentors, the first person that really touched me was Donnie McClurkin. My songs, just 1 or 2 albums for now. I have 2 great songs. The first one is Gratitude, just showing your gratitude to God. The other one is Calling Out Your Name. Everything can change, calling out the name of Jesus. Okay, Lagos, it's time to show some gratitude. Make we give gratitude to God. From me, titled Gratitude.
When I think about all you've done for me, how you set me free, open more. All I see around is testimonies, and because of your deeds, I am a superhuman. And they ask me what to do for me. I did tell them, Majesty, if it no be God, oh, if it no be God, oh, what I for carry me go, open more. If it no be God, oh, if it no be God, oh, I for sit down the loop. So I say thank you about the way me God. When I wake up, your praise is on my lips, and I worship you still. Oh, be more. You surround me with your grace, and now I see that you're always with me. You never leave me, yeah. Still they ask me what they do for me. I did tell them, Majesty, if it no be God, oh, if it no be God, oh, what's up for carry me go? Oh, be more. If it no be God, oh, if it no be God, oh, yeah, I for sit on the loop. So I say thank you, about so baby God.
Okay, welcome back. Did you listen to the song? I sure so I enjoyed that song. Gratitude. You can get my songs on all platforms, Spotify, AudioMac, Boomplay. Just type OMODIA and everything will pop up. You can find me on social media. First of all, on Facebook, you can just type OMODIA Ukolegbe. Twitter, you can catch me on OMODIA for real. On Instagram, OMODIA for real _. Just put the underscore. You catch me there. Okay, my people, we'll go soon to come out. But before I go, let me leave you with this. There's a songwriter that says, don't give up on God, cause He won't give up on you. He's able. Woo! Lagosians, I've had such a great time with you guys. But before I leave, let's just worship God together. Before I leave, we're going to do this song together. It's titled Calling Out Your Name. That is the name of Jesus, that name that is more powerful than any other name.
Standing in your presence, knowing all I have is you. I'm calling out your name. Your name, Son of righteousness. Come on, sing with me. Standing in your presence. Knowing all I have is you. Staying strong in worship. Doing what you call me to. Lord, your presence, knowing all I have is you. Staying strong in worship, staying strong in worship, doing what you called me to.
Sure, you had a swell time today on Entertainment Lagos. Because for me, I had a very super fantastic time. All right, Jen, do have a lovely weekend. Ciao, ciao.
The more we make you know about Lagos, the more you appreciate the global brand Lagos. See you next week.